I think that the ministry of medicine to patients is one of the greatest privileges that a human being could have in life. And I am thrilled and thankful to have been a part of that tradition that dates back so many centuries. In general terms, the mission of any physician is, number one, to relieve suffering, and number two, to prolong life. Now, as a cardiologist, I have certain abilities, skills, technologies that are part of my practice that permit me to do that. I initially went to undergraduate school in electrical engineering, and in the middle of a graduate program in electrical engineering decided that what I really wanted to do with my life when I grew up was to be a physician. And at that point I applied to medical school, and after graduation from a master's program at the University of Mississippi in electrical engineering, went to medical school. I applied a number of places and was fortunate to be accepted to the Mayo Medical School, which was fairly young at that time. I was in the third graduating class at Mayo. I went there because my dad had also trained there and said that whatever Mayo did, they would probably do it quite well, and I found that to be the case. When I finished medical school there, I proceeded to their internal medicine program, completed 3 years of internal medicine, and then went into the cardiology program there. And after 3 years in cardiology at Mayo, came back to Jackson. Doctors are obviously people like everyone else. We just have a different training than some other folks. All of us as human beings, and particularly those of us that have gone into medicine, have to decide how we look at other people. And I see other human beings who I am privileged to care for as being created in the image of God, and therefore with a dignity that requires my care and respect. At the end of the day, the greatest joy that I have is seeing a patient who comes to me with a problem being treated in an efficient way, in a cost-effective way, and in a compassionate way where the disease that they have is well managed, where they're better able to live with that disease, and hopefully to live longer. I have a wonderful wife with whom I have raised 3 children. We've been married since 1974. And I also have a wonderful nurse, Kaki McGann, who's been with me for almost 20 years. Many patients would rather come to me to see Kaki than to see Dr. Fyke.